Hi, today we will read about scrub typhi. Scrub typhus, otherwise called rickettsial fever. Scrub typhus is a mite-borne disease caused by Orientotsugamushi, which is seen on the body of the forest and rural rodents, including rats, owls, and field mice. The bite may leave a mark that makes a black color scar on the skin, and it is a bacterial infection. It is a gram-negative Coccobacillus. This Coccobacillus is a bacteria. After the bite, after 7 to 10 days will be the incubation period. When the mite bites, bacteria in the site multiply at the site of inoculation, and papillae may form that ulcerate and become necrotic, evolving a scar with regional lymphadenopathy, and may progress to generalized lymphadenopathy in few days. Patient will have symptoms of fever, malaise, loss of appetite, loss of weight, rashes, joint pain, severe headache. The rashes, macular rashes all over the body from the trunk and to the limbs, redness of the eyes, cough, pneumonia, enlargement of spleen, acute renal failure, and DIC, disseminated intravascular coagulation. And in severe illness, patient may develop thrombocytopenia. Also, severe illness, patient also develop respiratory failure, organ failure, and death can occur. And the diagnosis and yearly treatment results are better, and this lab results shows elevated hepatic enzymes, increased bilirubin and increased creatinine, and leukopenia will be present, leukocytosis may also present, patient with lymphopenia and hypoalbuminemia. These are the lab result findings, and it varies with the patient, and the signs and symptoms will mimic dengue fever or leptospirosis. So the diagnosis, we proceed to serology testing. First one is indirect fluorescent antibody, that is IFA. Another one is polymerase chain reaction, PCR. There is one more test, Weil Felix test, that is an agglutination test. It may be in the slides or in the tube, but it may give the false result. So the primary things is IFA and PCR, that is indirect fluorescent antibody, and another one is polymerase chain reaction. And biopsy from the scar area also can be taken, and the treatment will be doxycycline 200 mg per oral initially, followed by 100 mg BID for 7 days, and azithromycin is then alternative antibiotic. Especially if in the endemic area, if the worker is there, chemoprophylaxis can be used. Prevention with the weekly 200 mg dose of doxycycline is recommended. Started before exposure and continued for 6 weeks after exposure. Factors like vector abundance, climate, and farming and sanitation affects its spread. And control measures include cold flogging, clearing the bushes, and reducing rodent populations. Thank you.